Welcome, Alex. I can't wait to talk to you all about how we can prevent and improve our oral and our dental health today. But before we dive in, I'd love to hear what have you done today, or this morning, I should say, to nourish you, to take care of you.
Yeah, thank you so much for having me. I'm really excited to talk to you about all the things I practice and love to do. I'm big into biohacking. So, I had a far and near infrared sauna this morning before we jumped on the podcast because I found it was a little kind of dreary this morning and I love getting sunlight into my eyes, but we didn't get sunlight until now and it's kind of mid afternoon or mid morning. So that's what I started with. And then I'm also watching my parents' chickens. So I got them ready this morning and collected some eggs.
That sounds like a dream morning to me. That's amazing. So, can you tell us a little bit about you and what you do and how you got into working on airway health and root cause approaches to dental health? This seems very different to a lot of people in the dental field.
Yeah, well, my background in education was not traditional. From a traditional perspective, I was trained as a dental hygienist in Ontario, Canada, graduated in 2011. And then after I graduated from my Ontario college, I flew out west and spent over 10 years in BC practicing as a dental hygienist, but then also things that I was interested and passionate about, I kind of integrated it into my career as a dental hygienist. And one of the things I added on was a biological dental hygiene certification through the International Academy of um, oh, IAOMT, International Academy of Oral Medicine and Toxicology. So I have a different background in regards to functional dentistry, natural and holistic approaches to oral healthcare. But that actually started, if I take another step back, my dad is actually a dentist. So he started dentistry when I was born. And then when I turned 10, that was when both of our, education in regards to airway health started. So when I was 10, I didn't have enough space for all my teeth. And he took me to a traditional orthodontist in our hometown. And the orthodontist wanted to take out four bicuspids. So that's still traditional orthodontic recommendations where they take out teeth and they push everything back and they use headgear to be able to put the teeth in a nice place, but functionally it doesn't always work optimally. So when he heard that recommendation, he was like, I don't agree with that. So he flew to the States, took an orthodontic course, came back and said, okay, kiddo, you're going to be my first patient. Let's create some space for your teeth. So he put me in an RPE, which is a rapid palatal expander, and it just blows up the face. It has that little tool to kind of crank on the inside of the mouth. And I had severe headaches, migraines to the point of nausea. So he realized maybe functionally this isn't a good device. So he flew back down to the States, took more training, came back, and he learned about an ALF appliance, spelt ALF. And it was invented by Dr. Derek Nordstrom, who's a dentist in the States. And the way it works is it's a functional device. So it's a very thin piece of metal that goes on the inside of the mouth. It hooks into the first molars, which are called your 6-year molars. You can have it on the top and on the bottom. And every time your tongue goes up to the roof of the mouth and you swallow, you put pressure on the device. So it gradually expands the face. And it's considered more of a osteopathic appliance. So when I'm working with chiropractors, osteopaths, PTs, physiotherapists, they seem to like that device better because when they're doing assessments and checking your head, if your head's not moving properly, then there can be cranial strain and cranial dysfunction patterns, which we didn't know about. So I went through traditional ortho, he finished up my case. And then years later, I'm struggling with some of the major chronic head, neck, and facial pain and some airway issues because he didn't develop my face as much as it should have been. So if you're looking at the world of airway focused dentistry, they talk about intramolar width, which is the space in between the first molars on the top. And you want it to be a certain size because you want there to be enough space for the tongue. If there's not enough space for the tongue will fall back into the airway. So our tongue is our natural expander, and our lips and cheeks are our natural orthodontics. So airway focused dentistry starts at birth, at breastfeeding. And that's why breastfeeding is so key. And then as I'm seeing children as they grow and develop from the age of 1 or newborns to about 12, 13, even up as far as 15 years old, I'm gradually monitoring these kids every single year. If they're in active therapy, it's longer, more time in between. If I'm just monitoring consistently, then it's, gradual spaces. I'll see them more for follow-ups to see, is growth and development going in the right direction, or are we starting to see some relapse and we need to intervene with other methodologies? So I went on this journey with him in person, and we took courses all over the world together. So it was amazing to learn collaboratively and independently. And then we joined forces in 2019 and started working together again in Ontario, Canada.
Wow, that's an amazing story that you have so much personal experience and your dad being such a big part of it now that you're working with him. That's incredible. Are these devices that you still use, that ALF appliance or ALF appliance? Is that something that you use in practice now?
So he incorporated a lot of these devices when we were kids. So he became the dentist that was treating everyone my age that were in their teens, putting them all through orthodontic treatments. If people wanted this type of therapy, if they wanted just traditional ortho, then they would see a traditional orthodontist. But because he became so busy in chronic pain and biological dentistry, that kind of shifted his focus. Because when you're going through this functional airway focused dentistry and expansion, there's a lot of things that can come up, and there's a lot of management. Like, you're not just supporting this child, you're supporting the family and helping to manage and, guide a family can take a lot more energy and a lot more resources. And he has always been an independent dentist, had his own practice, never had an associate. So he had to figure out where he wanted to divert his energy and time. And that was when the practice shifted about, say, 15 years ago into more of a biological dental office.
And what is biological dentistry?
Yeah, so biological dentistry, if you go on to the IAOMT, they talk about all the components of biological dentistry. So it's using biocompatible materials that work synergistically with the body. So it's using things that are non-toxic. You hear mercury-free, fluoride-free, using lasers to help with healing. So that's the product and mechanical component of biological dentistry. There's a lot of mechanical dentists and mechanical biological dentists that have the tools and they know how to implement the tools. But then there's also a philosophy approach. So I'm always telling people you have to do a lot of research, because the philosophy component is someone comes in and says, my child is struggling with cavities, and what are your recommendations? A mechanical biological dentist is going to recommend products specifically, like use a non-fluoridated toothpaste. Maybe it contains hydroxyapatite. Here's some oral, aids and water pick, oil pulling. All of that is great. I definitely don't downplay that. I think, oral care is very important. But the other component of that is the microbiome and nutrition. Are they getting the minerals and nutrients that they need? Are they drinking toxic water? Are they breathing in toxic air? Are they using toxic chemicals and products in the house that are creating allergies and autoimmune issues? And detox pathways. If you are absorbing toxic chemicals and foods and everything in your environment, are you able to excrete properly? And that's where the philosophy comes from. So I'm seeing a huge disconnect. I'm seeing a lot of new biological dentists that are jumping on this bandwagon because they think it's really interesting and it's hitting some of the main points, which I think is great. I think the only reason we're seeing such an uptick in interest in biological dentistry is because parents, moms, are saying, this is what I want. And the dentists are like, okay, we need to educate ourselves on what this is. Because if 50% of your population is declining fluoride and they want other alternatives, that starts to change the paradigm, which I think is great. But you have to make sure you understand the root cause of why these deficiencies and imbalances are happening, and how to support that family or that child at that level and work collaboratively with other professionals.
So how do we find a holistic dentist or like a biological dentist that does have the mechanical side and has the root cause approach all combined? Like it sounds amazing what you're saying, but I have taken my kids and myself to a number of dentists and I haven't found that. Where do we go? How do we find that if we can't come to you and your dad?
Yeah, so he is still practicing. He practices on Thursdays only. I'm trying to get him more online as well because I would love for him to be able to have these conversations with people and be able to support them wherever they're at. Because the biggest question I get is this question, like, how do I find somebody? And if there's no one in my area, what do I do? Well, that's when I, guide people to say, here's someone that mechanically can do what you need them to do, but then we can touch base. So if you are looking for someone online, the IAOMT, International Academy of Oral Medicine and Toxicology, has a directory of biological dentists. So they have their qualifications, if they've been SMART certified, which is safe mercury amalgam removal technique. If they've taken additional courses, it will be on that website. And when they started going through the courses and getting the certification. So I took my training in biological dentistry in 2011 when I graduated. And then I got my certification for biological dental hygiene. I think it was 2020, 2021, but I've been practicing and going to all the most of the yearly conferences. So I've had quite a background and met a lot of the pioneers in biological dentistry, which is amazing because they have, 20, 30, 40 years of, science, books, research, like doing amazing things. But it doesn't seem until the last 5 years that people are really starting to be more curious about biological dentistry.
Yeah, it seems like it's really exploding in popularity and just awareness right now in the last few years. So, why is oral health and airway health important?
That's a big question. So when you think of oral health, you're thinking of, the conventional model will say, if you're looking at a window into the body, the mouth is the window to oral health. So if you're seeing inflammation, if you're seeing periodontal disease, cavities, any oral health disease issues, there's a lot of research and therapies and technology that can show you that there's certain things happening in the mouth that need to be addressed because it can affect the rest of the body. So we know the link between heart disease, even brain health and gut health. So there's a lot of talk these days about oral microbiome and gut microbiome. So if your oral microbiome is off, then your gut microbiome is probably off as well. So a lot of products are being recommended to help balance out the microbiome. There's some really great products where you can test and swab for oral DNA, and that gives people a lot of information as well, like what's your genetic background, what was your parents' genetic background, is there any detox pathways that might be affecting how well you can absorb certain minerals and nutrients? You're not just taking a supplement and it's not working for you. Um, it's a big question. So once you clean up your oral health, then the rest of the body starts to be healthier and more, synergistically working properly. When I see decay rates in children, it automatically tells me that there's probably a massive gut dysbiosis. So you have to kind of take a step back and say, how does decay actually form? And there's a really great book written by Nadine Artemis called Holistic Dental Care. And there's a section of that book where she explains that teeth are like water fountains and they have holes in them, like pores in our skin. So our teeth actually breathe, which we don't talk about this enough. And if you put fillings, crowns, certain things to cover the tooth, now you're suffocating the tooth and it can't breathe as well as it should. So a healthy tooth is actually going to be, has all these fluids, lymphatic fluids that come up through the pulp of the tooth, the inside, and, come out through the pores. If you get dysfunction, dysfunctional microbiome, and imbalances, then sometimes that those pores, instead of coming from the inside out, they go in the opposite direction. So she had a really great reference to a rat study where they put dye in the rat's mouth and automatically the teeth turned blue. And then she referenced the other study where they injected the radioactive dye into the stomach, and it shows up within, I think, within a few hours that the teeth turn blue. So it kind of gives you a visual of how important the gut microbiome is for supporting oral health. And anytime I see periodontal disease, it's not just in the mouth, it's throughout the rest of the body. So periodontal disease is bone loss, it's osteoporosis. So if there's osteoporosis in the mouth, there's probably osteoporosis in the body.
Wow. So it's big.
It's big. It gives us a really good, idea. And as oral health practitioners that are more educated on airway health, we can see if there's a mouth breathing issue, if there's certain dietary things that, someone is eating, or even deficiencies, like scurvy, vitamin C deficiency, certain ulcers in the mouth. Like we can ask these questions, if there's certain deficiencies or if there's certain products that are being used that are causing trauma to the oral cavity.
So what is that connection between what we eat and our dental health? Like you're talking about that a little bit there, but can we get a little bit more specific? Like, are there specific foods and nutrients that we should be eating more of if we're noticing that our kids have cavities or other issues in their
This is a
mouth?
hot topic. This is a question I also get a lot because people will say, well, what types of food should I eat? And um, I have a really hard time telling people what to eat because there's a lot of emotional um, and our background, our genetic background, like, where did we originate from? I do believe that what our ancestors ate maybe should be more in alignment with what we should be eating. I noticed certain, demographics where people would come in and they would be from another country, and then now they're in Canada and they're eating the standard, SAD diet, standard American diet, or Canadian diet, and they're rampant with decay because they're not used to processed foods. So my number one recommendation is stay away from processed foods as much as possible. Eat as local. I say I'm a localvore. So I eat meat, dairy, fruit, veggies, even grains that are within my local community. And then it's not, I'm not getting the exposure to all the chemicals, herbicides, pesticides, all the sprays that they're, spraying our grains with, because I'm eating food as local as possible. That's not being shipped very far. But then I also don't have to worry about food sitting in warehouses. Like, I don't think people realize how long meat, eggs, dairy, like fruits and vegetables. Like, I don't think people realize in Canada how long some of these products at their, big chain grocery stores sit in warehouses before they end up on grocery store shelves. Like eggs, for example. I didn't know this until 6 months ago, that eggs from a big egg farm, like co-op farmer, can be on the farm for 30 days before they're shipped to a warehouse where they get graded. and they could be in the warehouse for a maximum of 30 days. So you may not be getting eggs for about 40 to 60 days after they've been created. So that's why they have to be refrigerated. So now my eggs come from my parents' farm where they might be a week old at most.
Yeah, I'm jealous. I want to get eggs like that just outside my door. That's a goal right there.
Yeah.
So yeah, so you're hesitant to like tell people specific foods, and I get that because there's just so much pressure and emotion behind food. But are there key nutrients? Like we're all human. Yes, maybe my background might be different from yours and the next person's, but ultimately we all need certain vitamins, right? We all need a certain amount of protein. Like, is there anything in that we need specifically that help to strengthen our teeth or just reduce our chances of having cavities?
Yeah, well, I can speak for Canada, for example. We're severely deficient in vitamin D. So
Mm.
we don't get outside enough. We don't eat enough certain types of foods that, produce vitamin D. Um, the issue with vitamin D in Canada is the sun, our sun exposure is so limited, right? So we get vitamin D through a few ways. It's through the skin and orally. So if we're not eating foods that are, we eat a lot of depleted foods, we're not getting it from our food sources like we used to. So a lot of practitioners now in this space, especially the oral health space, are recommending supplementing with vitamin D. And I know there's controversy on that. But what we've noticed with certain practitioners that attend our conferences on a yearly basis. Dr. Stasha Gomniak, she's a neurologist. She noticed that people had less neuropathy and sleep issues when they increased their vitamin D and K2. And so we've noticed this in our own practice as well as, if we see children that are developing or, developing more decay, we want to know what is their vitamin D level and what can we do to optimize that as well, because vitamin D is a hormone. So I feel like it's treated as a vitamin and it's, there's a certain recommendation that's made, but people don't realize that 1000 IUs is for the average optimized person. And most of us are severely deficient in that. So when your vitamin D is low, your gut microbiome is not working. And what she noticed in the studies was once you got your vitamin D levels up to a certain level, then your gut microbiome came back on track. So the key nutrients that I'm noticing people are deficient in is vitamin D, B vitamins, iron, zinc, selenium, magnesium, copper, like, these B vitamins, as well as a lot of key nutrients that come from optimized foods like meat. That we have a hard time absorbing those same nutrients, and there's such a deficiency in our fruits and vegetables. We just can't get enough from a strictly vegetarian vegan diet. It just, we see rampant amounts of decay in our vegan and vegetarian patients at the practice. So we've had a few patients that are open to taking liver supplements, because the liver and oysters can be a superfood. They have a wide range of minerals and but vitamins and things that we need to optimize overall function. I've also had a lot of moms that are pregnant that take dehydrated beef liver capsules, and they notice that they have less nausea, less irritability, postpartum depression. Like all those things start to get better once they acknowledge the mineral and vitamin deficiencies.
Yeah, minerals are huge, aren't they? And so are vitamins. And it just seems like nobody is at optimal levels. My husband's a GP, and I don't think anybody, even in Australia, most people were low on vitamin D, which is surprising because there's so much sunshine there. But still,
What are they
we live indoors, right?
But what are they doing even when they go outside? They put sunglasses on and they put sunscreen on,
Yeah.
and we have vitamin D receptors in our eyes. And sunscreen limits the capacity for vitamin D to be absorbed in our skin. So we're doing all these things to not allow vitamin D optimization.
Yeah, it's not surprising when you explain it like that, is it?
Yeah. Yeah. So there's a lot of things we need to change in regards to our lifestyle. I used to think in my 20s, man, it's boring that people just go for walks after they're finished work at the end of the day and they cook dinner, and they hang out with their families. Like I had this kind of mindset of, wow, that's a boring life. And now that's what I do. After I finish a day of work, I ground myself. I meditate. I'm more likely to spend time cooking and preparing a meal, or putting together, a nutrient dense foods that I want to eat that I know are going to support my whole structure. Sitting in front of the fireplace, getting that red light therapy before I go to sleep, and supporting my nervous system. So it's funny how things change.
Yeah, completely. I'm the same way. Right now, it's all those things. I find it challenging when it's cold outside to do the grounding. What do you do for that in Canadian winters? Do you go outside and like lie in the snow or
Well, we haven't had a lot of snow this winter
that's
that's
true.
actually stuck around. So I still go outside every day in my bare feet and ground. I have a dog, so it's easy to get outside and just, let her go do her thing, and then come back inside. And then I'll have a sauna in the morning just to kind of set my day. And then I've started incorporating cold plunges as well. So I find I get too tired and relaxed after a sauna. So then I need that cold plunge to kind of, you know, boost me up again, so I can take on my day. But yeah, grounding's important. I wear grounding shoes, so barefoot shoes. I use the Vivo running shoes, and I also have the barefoot sandals. So I try to incorporate as much grounding throughout the day as I can, and I wear those shoes when I'm at work as well.
So it sounds like from what you've been saying is that like our dental health and our oral health, it's all connected, not shockingly. Like obviously our mouth is connected to the rest of our bodies. And there's all sorts of lifestyle shifts that we need to make to have overall optimal health and overall optimal dental health. Are there any specific lifestyle shifts that you see are really important that like are the number 1, 2, and 3, let's say, shifts for improving our dental health or our kids' dental health? Or is it just we should be doing all of it? We should be getting outside, we should be eating the food, we should be sleeping well.
Well, people get overwhelmed with all of that,
Yeah.
right? And I'm even overwhelmed as a professional because I'm recommending, extensive suggestions. And I'm like, okay, wait a minute. We need to break this down into bite-sized pieces. So the very first recommendation I would make is, how do you breathe? Do you breathe through your nose or do you breathe through your mouth? Because our nervous system is impacted by how we breathe. So if you breathe through your nose, you're typically more going to be in parasympathetic, rest and digest. If you're breathing through your mouth, you're more likely to be in sympathetic, fight or flight. So what I've noticed over the last 3, 4 years is, we had a massive pandemic, depending on where you are in Canada or the world or what you did for your line of work, you may have had to wear a mask. And that changed the way we breathe as a society, as a collective. And so I noticed a lot of mental health issues that came from, not just the fear that was being, thrown at people the last few years, but if they had to wear a mask or if they felt like they needed to wear a mask, it changed their mental health as well. So getting back to proper functional breathing patterns, I think is key for self-regulation, not just for yourself, but also for people in your community, whether it's your family, your friends, you're a teacher, you work in the healthcare system, the more that you can regulate yourself. So I've actually been giving um, talks at local clinics with medical groups, any group, because if you can address the people at the top, then that supports the rest of the system, right? So I've had some amazing people that get stuck, um, in fight or flight response where they get, it was like yelling or screaming or, certain things, people were quite, you know, reactive over the last few years, then these people could kind of figure out, okay, what's going on with me? How am I breathing? How am I reacting to the situation? And they could balance themselves. So it's been a great tool for me. I'm so glad that I took the training that I did, and I took it just before the pandemic so that I could see, how I was responding to things as all this emotional trauma came up for people, and how to manage it with with changing the way I breathe. So that would be my number one. Number two is just slowing down, spending more time in nature. I know in Ontario, for example, a lot of people are stuck in that hustle culture. We were just talking about that previously, right? One of the reasons why I found it a struggle to move back to Ontario from the West Coast, I was living in British Columbia for almost 10 years, was there's such a hustle culture in center of Ontario. Like, you work your 5 days a week, you run your kids to all these activities, and then you get 2 or 3 weeks of vacation a year. Where out west, people are going for hikes in the middle of the week and, taking more vacation time and spending more time outside in nature. It could be the environment too, like it's a, milder climate on the West Coast. But I just noticed people are more sedentary and spend more time indoors and less movement. Like it's more of a struggle for people to move. So I always say motion is lotion. The more that you move, the better that you're going to feel. You focus on your breathing, you become more grounded in nature, and then that energy can kind of carry you throughout the day.
And you make that sound doable, like, when you break it down to that. Yes, there's lots of things we can do, but if we stick to those 3, that's huge, isn't it?
Yeah.
So how do we change our breathing? And with that, how do we help our kids if we realize that they are breathing through their mouths? Because I think we're in this epidemic of mouth breathers. How can we shift that?
So there's a lot of information out there right now. I'm seeing a lot of people talking about lip taping, breathing through the nose versus breathing through the mouth, tongue posture, using certain types of nasal sprays to help with improving nasal breathing. And if you want to work on it from just a product and improving function, a really great reference is Patrick McCowan. He wrote The Oxygen Advantage. So he wrote a book about what his experience was as a young child to his years in school, and how he struggled to, he never slept well. He had a hard time in school learning, being able to concentrate and focus really well, and it impacted his sports and his everyday life. And I could relate to that story because that was my story as well. I never slept well. Um, I would wake up in the morning as a child with lots of drool on my pillow. As a really young child, my bum would be up in the air. I'd roll off the bed quite frequently. I wake up first thing in the morning and I never felt well rested. I was always tired, um, craved sugar like crazy, um, couldn't concentrate in school, struggled, even to keep up with sports. So I think the first thing is you want to look at, what do your children look like when they get up in the morning, and ask them the questions, how did you sleep last night? Like, do they, jump out of the bed, feeling great, or do they kind of roll out of bed and struggle to get moving in the morning? Because there could be an airway issue. There could be restriction in their nose that's preventing them from being able to breathe properly. So I go over a series of tests to see, is it an external kind of congestion, allergies, inflammatory process, or is it more inside the nose? Where you may need to see, in Canada, you have to see your medical doctor and then be referred to an ENT. If you think that there's tonsils, enlarged tonsils, adenoids, or some sort of turbinance or deviated septum issue. So I kind of go through the functional component to see if we can address it with, like I said, a nasal spray, a non-medicated nasal spray. My recommendation is Xlear. It's spelled Xlear, and that really helps to kind of clear the nose. And then going over exercises that Patrick McCowan goes over to decongest the nose. we can't get resolution from that, then we kind of work through other steps while you're waiting to get in to see your medical doctor and ENT.
Okay. Well, I'll put all those in the show notes as well as a number of other things that you have mentioned today, because I think those would be really great resources for everybody to read and look at. So can you talk to us? I know we've talked about cavities, but what can we do if we realize that our kids have them? Is it just doing all the things that you've already mentioned, or like what is the first step? Do we go to a biological dentist and then we take it from there, or is there anything that we can do at home to help our kids if they already have them?
Right. So, this is an epidemic right now. A lot of kids are struggling with decay, and I'm seeing, a lot of great families that come into our practice are eating really healthy, and a lot of them are nutritionists, naturopaths, have training in nutrition and are feeding their kids to the best of their ability, and they're still struggling with cavities, and they don't know, what are they missing, right? And they're brushing, flossing, maybe oil pulling. They're doing all the oral hygiene stuff to the best of their ability and nutritionally trying to support their child, but they're still seeing cavities in the baby teeth. And I always say you have to take a step back and look at mom's nutrition when she was pregnant with baby. So this can always, I find this is a sore spot for moms, and there's a lot of guilt associated. But the problem is there's not enough support for moms at this stage of pregnancy. I ask was there any issues with nausea? Was there issues with nutrition? Was there anything that you were struggling with? Did you get cavities after giving birth to your baby? So if there was nutritional deficiencies while you were pregnant, that's when the baby teeth are first initially being formed. So baby takes what baby needs. So if you're deficient with what you're needing for a healthy body, then baby's only going to get a percentage of that. So then you're deficient, baby's deficient, and then you give birth. And if you were able to breastfeed, that helps with, continuing to get those minerals. But I'm seeing a lot of moms that struggle with breastfeeding because of lip and tongue ties and low tone and function issues. So you kind of have to spend the time to ask these questions. And I find in a traditional, even a biological dental office, there's not enough time to have all these conversations, right? So once I, usually see a child in a traditional office setting, you usually see them at 3, 4, or 5. And by that point, you've missed some of the, phases where you could really support that family. So if you're catching cavities at 4, 5, 6 years of age, that started in utero and you can't go back. But if you catch cavities at a certain stage, then there's things that you can do to remineralize the teeth. So if you catch them within the first surface of the tooth, which is the enamel, you catch it at the very early stages, then you work on gut health, uptake of minerals, vitamins, nutrient dense foods, working on detox pathways so that if there's toxins being, taken in, that they can excrete properly, that will support remineralization of the teeth. If you catch them and it's further than the first layer or making its way into the second layer, then you have to intervene with dentistry, and you have to go in and remove that decay, because then it can become painful and you can get infections. It can become a bigger issue. And so it's hard because, parents are doing everything as recommended from their oral health providers, but unfortunately, we're catching it too late. And in my opinion, I think we should be seeing kids at, newborn babies, because then we can assess lip and tongue ties at 1 year of age. Once they start getting their baby teeth in, what does the spacing look like? Do they have any chewing, swallowing, sucking patterns that might be impacting oral function? Are they mouth breathing? So if you're breathing through your mouth, you're drying out the mouth and you're not getting the teeth bathed in saliva, which our saliva is our microbiome. So we're not remineralizing the teeth that way if the mouth is always open. So it's a bigger conversation, depending on where I'm seeing the family and where I'm seeing the child. What can we do to support at that age and stage? And then these families, usually once the baby teeth fall out and the adult teeth start coming in, then I don't notice the same rate of decay because they've
Because
done
they've done all those things?
they've done all those things. So I'm seeing more of because the adult teeth are underneath in the bone. So all the good food, the nutrients, the, detox pathways, like they're clearing toxins, they're, breathing better, they're functioning better, they're sleeping better, they're getting into the proper stages of sleep. Then I'm seeing healthier adult teeth than their baby teeth.
Well, that's promising. So if you do this work, even if you catch it a bit late, there's things that you can do to make the teeth that we keep lifelong healthy.
Yeah.
So you speak a lot about detox pathways. Can you tell us a little bit about like what these are and how we can support our own and our kids so they are eliminating toxins and things that come in?
Yeah, so drainage pathways, I didn't know anything about this. I, get some amazing patients that come in and teach me so much, because right now I'm working in a biological office as a biological dental hygienist part-time, and then I run my myofunctional therapy practice part-time. So I'm very busy, but when I'm in my biological practice, I get to see a lot of amazing people that teach me so much. And this one particular patient was talking about drainage pathways for like a year or two. And I'm like, what the heck is this person talking about? And she's like, well, you're peeing, pooping, and sweating. And I'm like, well, what does this have to do with any? And then I was like, wait a minute. When we talk about removing silver fillings in this practice, one of one of the things the dentist won't do is just remove a silver filling. We want to know detox pathways. So what this dentist will do is take a recommendation from a naturopath or a nurse practitioner. That's who we have access to in our community, and ask for a quicksilver test, which is a heavy metal test, which tells us, where is mercury coming from? Is it coming from your food, from your environment, or from your mouth? So you can see exactly where the mercury is coming from. And then it tells you your detox pathways. So are you able to excrete that mercury out of your system naturally? Because if you're not excreting, then those toxins are circulating in your system. So that's one of the biggest issues I see with some biological dentists that don't understand this is they say, oh, we're going to take out all your silver fillings, and they don't look at drainage pathways and detox pathways. So some of these people get sicker, or they don't get better. They don't notice a difference because no one actually explained that and actually did the proper testing before. So this particular patient told me about a really great naturopath in the States. Her name is Sinclair Canale, and she owns Detox Rejuvenation. So last January, I signed up for her course, and I was blown away to learn about how to support your detox pathways. So she talked about sweating and the ways to promote that, which could be using a sauna, near or far infrared, doing castor oil compresses on the liver, um, dry brushing to stimulate lymphatic drainage, certain movement patterns, certain supplements that actually will bind and then excrete. So you're able to properly excrete. I didn't realize that most people are not having regular bowel movements. So most naturopaths that I had met would ask the question, do you go to the bathroom, or do you seem regular? And you'd say yes, and then that's it. But when I actually started diving a little bit deeper with these patients, most people were like, yeah, I go once a day, or I go once every few days. And they think that's normal. And they've never been told or noticed anything online, or, haven't had a practitioner actually dive a little bit deeper with what that means. So I realized, most people eat 3 times a day, and they're lucky if they go once a day. So they're bound up. And a lot of people don't sweat well. So we want to make sure we're supporting those detox pathways efficiently. And that does step out of my silo, right? Like most people are asking, why are you talking about if I sweat, pee, or, or poop? Because that's, your scope of practice is here, right? But it's really important to help with proper healing. Because I think a lot of us are really bound up with a lot of toxins and we're not excreting that properly. So our livers are, super taxed. And uh, that's one of the first, I wish more practitioners would touch on this instead of throwing supplements at people.
Yeah, it seems like a really useful place to start, right? We need to be able to excrete everything that we don't want and then start from there. Yeah.
So I think that touches on with kids. Like we're seeing a lot of wired kids that are very dysregulated and don't know how to regulate their emotions, whether they're with their parents or at school. And I'm seeing a lot more people talk about that. I don't have kids of my own. I would love to have kids one day. So I find this is kind of a touchy subject for parents, having kids that don't feel like they can regulate themselves well. I think a big component of that is heavy metal toxicity.
Because they're just not getting them out.
They're getting them through different avenues in their environment and they're not excreting. A lot
Right.
of these kids are bound up.
Yeah. So what are some of the ways that we're getting them in? Is it through our food and our water? Or like how can we reduce, because it'd be great to, yeah, I don't know, have our drainage pathways and our kids' drainage pathways working optimally, but also why bring the stuff in the first place? So if we don't have the fillings, if what else can we do to reduce the heavy metals that come into our bodies?
That's a big question because a lot of our food systems and the products that we use are not being honest with us. So I just posted something yesterday about it was a chart and it was talking about all these different health ailments and what metal might be associated, what heavy metal might be associated with those health ailments. And I just learned that diapers contain mercury. Certain brands have heavy metals in their diapers because some of these products are being made in China and then being shipped into the United States and Canada. And we're not told that there's, some of the toys that kids buy have heavy metals in them. Um, you know, might seem like a controversial subject, but they're definitely talking about it more. They're putting aluminum and heavy metals in our skies that are preventing changing weather patterns. And that was that was kind of told that it was kind of a, conspiracy theory, but now they're actually saying like, this is how we change weather patterns. So that those metal particles are ending up in our food supply. And then also spraying the grains in North America with folic acid. So are certain things that they don't have in Europe that have been banned, like glyphosate, are, being sprayed in our, are being used in our grain products so that it dries out, the last process before they actually processed and harvest the grains. And then higher levels of glyphosate are ending up in all of our packaged foods. So um, we have to think a lot more about what we're putting into our body, and we have to do a lot more research. And I find that parents are severely overwhelmed with it all. And water, you'd mentioned, when you look at the pipes, how are you getting your water? Like, where is your water coming from? There can be heavy metals in the water supply, depending on how you access that water. So I always tell parents, start with the fundamentals. If you can get an air purifier in your house, help clean up the air, that will help clear up some of the allergens. If you can get some sort of water purification system, doesn't have to be thousands of dollars and hooked into your house. It could just be something that sits on your countertop, just to start, just to see if that makes a difference. And buying certain types of products that may still be in a package, but might be more local. Like I found certain brands of cereals that are organic and glyphosate free. And so that people can still have those products in their home without, making them or having to go through a lot of effort, they can find a product that will still work for their family, but has a lower toxic load.
Yeah. Yeah, those seem like good places to start. Yeah. So before we jumped on this call, you were talking about how improving our kids and our own like dental health and airway health can seem like a really pricey endeavor, but there are ways to do this that are not going to have us remortgaging our homes. Like, what can we do to provide our families with the products that they need and the services that they need to improve their dental health without, yeah, breaking the bank? What can we do?
A lot of people want to know what types of toothpaste brands I recommend.
Mm,
And a lot of the natural toothpastes are pricey. Like in Canada, it could range from, 15 to $25 depending on the tube of toothpaste. And I always say we're not deficient in products, we're deficient in minerals. So you can make a lot of it yourself. Like if you wanted to just have a basic product, a lot of the ways they used to make like kind of like a slurry, and there's a great company, Earth Paste. The inventor of Earth Paste used to talk about how his grandfather used to put um, clay, I think it was coconut oil, and salt and a little bit of water and mix it in his hand, and then he'd brush his teeth with it. And that was how, that's how they had toothpaste. So you have to look at things, what you think you're going to use and what your family is going to use. So if you do like the tube, you like to have a tube of toothpaste, there's some really great natural products out there. I can't think of any. Boca is one with hydroxyapatite. You want to look at products that have that are fluoride free, and hydroxyapatite seems to be the new competitor that's taking over fluoride. So I have a lot of issues with fluoride, and there's actually some trials going on right now because it is a neurotoxin. So a lot of companies have started incorporating hydroxyapatite into their toothpaste, and hydroxyapatite is a natural compound that's found in our teeth. So it's more bioavailable and compatible with our oral cavity. So I still have concerns about it though, because it is still fairly new, but the data and research is looking promising. And I like that they found an alternative, because I don't think we'll ever fully get rid of fluoride until there's another product that you can sell on the shelf. So if you want to go down the toothpaste route, looking at toothpaste with hydroxyapatite, I think is a great option. The other component is tooth tablets. I think it's called Tanit, is a company in Canada. And so it looks like a little mint that you crush up in your mouth. It's safe to swallow and you can brush your teeth with it. Another product that you can use are tooth powders. And Aura Wellness is a great company that carries some tooth powder, which it's just like it sounds. You put your hand out, you put it. It's usually a mixture of baking soda and certain essential oils to help just brush your teeth. And there's no additives. So the closer you get to a tablet and a powder, then they have less fillers and binders. So if you're looking for a more natural approach, that's kind of the way I would go about it. If there's certain health concerns that you're wanting to address, then if people have gum disease, like their gums are red and bleeding, and they're more prone to cavities or more prone to bad breath, then I would recommend oil pulling. Now, you can use, coconut oil, castor oil, which doesn't taste as great, but the number one recommendation is coconut oil because it tastes the best, and you swish with it and it helps to draw out impurities. There's not a lot of research and studies on it because you can't really turn it into a product that you can sell and make a whole bunch of money off. So I'm for products that are more natural and have less fillers and binders in them. So I have a really hard time recommending a certain, product or big brand. I would rather work with as natural to source as possible.
And with flossing, is that something that you recommend that kids start doing from a pretty early age?
So flossing is another interesting topic. There's been some controversy on it. I'm not sure if you've listened to Huberman's most recent podcast. He had, I think it was an hour and a half to 2 hours, where he talked about all these different oral hygiene aids and products. And he had mentioned one specific dentist has come out and said a lot of negative things about flossing. And I don't disagree, because flossing, most commercial floss products have chemicals in them and PFAS that you don't have to put on the label, because it's such a small amount. So I get a lot of natural families that are afraid to use floss for that reason. So if they don't want to floss, you can use something like a water pick, and that can be really helpful for cleaning. Oil pulling, once again, there are some more natural flossers that don't contain that, and you can use those in between your children's teeth as well. But 100 years ago we didn't floss, so why are we flossing now? And you have to look at our diet, like what are we consuming? What are all the toxic chemicals? Processed sugar, carbs, all these additives in our food. I think that's causing more issues than anything. So I'm not yeah, I'm going to be controversial on this one. I don't think flossing's curing tooth decay, but if you're not removing those irritants, then you probably are more predisposed to cavities. So depending on what your diet is, like if you go into the jungle where people are just eating what's within their environment, they're not flossing and they're not getting cavities because they're not exposed to Western diets. And a really great dentist studied this. His name is Weston A. Price. So I know you know a little bit about him. He actually lived in Canada, not too far from where I live right now. And he studied tribes in certain areas of the world that were not exposed to processed foods. And they had beautiful straight teeth, no crowding, no dental decay, no issues. And once they started incorporating more processed foods and high sugar foods, then you started to see the collapsing of the jaws and the airway and more dental decay issues. So I don't think flossing is going to solve all these issues, but at the same time, because our food systems are so affected, I think it's a good idea to still have some sort of intradental oral care as part of your daily routine.
Yeah, it's interesting. It seems like over and over on this podcast, no matter what the topic is, it's pretty much that the further we move away from Western society, the better off we are. And our teeth are no different, are they?
Yeah, exactly. Yeah, we need to get back to our local food systems and supporting our local farmers, because I was listening to a documentary that came out about the soil, and our farm, you're in contact with a farmer 3 to 4 times a day because they produce our food. But how many times do you see your doctor, your dentist, your dental hygienist? Like, you know, we need to be supporting our local farmers more.
Yeah, or producing our own food if we can, or having our own chickens.
Exactly. Exactly. And I find that we're so disconnected now from that process that people don't even know where to start. Like, for example, my parents have this huge pile of manure on the back of their property and wood chips, and that's what they use to create soil. And people don't even know how to like even know where to start to create soil. They think they have to go to their garden center and buy a certain type of soil to promote how fruits and vegetables can grow properly. But you need the component of animal byproducts to make good quality soil. So even if you are a vegetarian and you're eating lots of fruits and vegetables, well, your vegetables are grown in soil that is created by animals. We need animals to keep the system going.
Yeah, that biodiversity is so key. That's why monocropping doesn't necessarily work, especially in the long term. So, yeah. I like the approaches of like permaculture, and there's a number of different farming approaches that animals are an important part, right? They naturally walked across the land where people used to grow things, and now farms intentionally have them for manure as well.
Yeah, yeah. That's somewhat of what my parents have built here is this farm that has, and, I'm not sure if you know of Joel Salatin. He's the biodynamic farmer in the States. And he talks about how to integrate animals and, building good quality soil and good quality infrastructure. So my parents actually live beside a farmer's field. Like their house was built in an old farmer's field. And when they came here, I remember our backyard was just dirt growing up. And my dad had the hardest time laying seed. And I think almost 3 to 5 years, it took him forever to plant trees and to get grass seed actually sprouting and developing because the land was so depleted that you couldn't grow anything on it. And they're also on the Canadian Shield, which like this much soil. So he's had to learn over the last 20 years how to build soil, how to create soil, and then how to create the infrastructure so things will survive.
Yeah, and that's so important for our health, isn't it? Like we need that good soil to get the nutrients into our bodies to then feed our teeth, and it's all connected.
It is. It is. We have to be more connected with nature to be able to support our systems and where we're at. And unfortunately, that's getting more and more challenging uh,
Yeah.
as we navigate this, right? So, um, yeah, getting to know your farmers, checking out communities like Weston A. Price. Sally Fallon has a Nourishing Traditions cookbook, which talks about all the um, nutrient dense foods. So if you really don't know where to start, that's always my recommendation is, go to Weston A. Price, check out the Nourishing Traditions cookbook, and it will talk about bone broths. It'll talk about good fats, good oils, all the things that we need to support our microbiome in our system. And then getting in touch with a chapter leader because there are people throughout Canada and the States, I think internationally actually, that you can reach out to that specific chapter leader and they can connect you with local farmers. So people that, grow their own fruit, vegetables, have beef cattle, pork, chickens, eggs. Um, I find that's the biggest issue is we get new people into the community and they're like, where do I even start for my food systems? And that is always a really good resource to use if you're new or if you've just become more aware of this type of um, diet and lifestyle.
Yeah, no, that sounds amazing. I'm gonna check that out myself. I love that cookbook. That was one of the cookbooks I used when I had my first child.
Awesome.
So on a slightly different note, I'm wondering what you have to say about like the impact of airway health on kids' eating habits and fussy eating, because I've heard that there can be a connection there with like tongue positioning and jaw development on what kids want to eat. Do you work with parents on this, or is this an area that you know about?
Yeah. So whenever I see a child that's considered a picky eater, I always want to know if there's a structural issue associated with that because what I'm noticing is orally sensitive kids usually have low tongue posture, which means the tongue is not coming up to the roof of the mouth. So we have to figure out why is that happening? Is there a tongue tie, known as a tethered oral tissue? We all have them, but it's like the webbing in between our fingers. So if I was to show you the webbing here, this would be a class 1, this would be a class 2, 3, 4. So it's like a dog on a short leash. So the more webbing you have, the more that dog's being yanked on the leash. So if the tongue's not able to get to the roof of the mouth, then you're not able to actually chew and be able to bring the food up to where it needs to go and then bring the food back. So it could be an airway issue. It could be protecting the airway, a mechanism that way. Or if there's a tongue thrust pattern, which means instead of the tongue going up and back, it goes up and forward. And tongue thrusts are started with certain habits. So if you had your child on a bottle for longer periods of time, it can create a space in between the front teeth, and then that tongue wants to come forward. If the baby was on a soother for over 6 months, that's why we recommend, cutting the soother out if you feel you really need it. If you have it longer than 6 months, you're more likely to create a low tongue posture and a forward swallow pattern. So that's what a tongue thrust is. The tongue wants to go forward instead of back. And also thumb sucking. The child puts their thumb in the mouth, the tongue wants to sit low. You create an opening because that's where the thumb sits. So now there's a space in between the front teeth. And now when the child goes to swallow, they have a forward swallow. And that can be an issue with chewing, because if you put food in your mouth and you chew, and then you go to swallow and you bring it forward, now it's creating more of a gag response. So if you're using, if you're eating chewy foods like steak, for example, any child that has a forward swallowing complex chewing pattern, they may not like steak because they might feel like they're choking on it. So then that's when they're working with me through myofunctional therapy, or they might also be working with a feeding therapist, an OT that has training in swallowing. So it depends. If I'm working with someone that doesn't have severe swallowing and chewing and speech issues, then I'll see them. But if there's an underlying speech or oral habit or swallowing issue, then I'd send them to or another professional that would work with that, or we just kind of dovetail with each other depending on where that child's at. So picky eating is not always picky eating. There could be an underlying airway issue or swallowing issue that could be impacting that.
Yeah, amazing. So, are there any final words of wisdom that you want to provide us with, or anything that you wanted me to ask that I didn't hear?
Yeah, so kind of dovetailing into what I just spoke about was myofunctional therapy. So knowing where tongue posture and everything needs to sit so that you can develop the most, functional face, right? Because I get a lot of parents that ask, I want to prevent braces for my child, but then I'm seeing them at 10, 12 years of age. And at, around 9 years of age, 90% of the face is developed. At 6 years of age, around 60% of the face is developed. So if I can catch kids early at like 3, 4, 5, 6 of age, then we can develop the face naturally with working on breathing through the nose, tongue resting on the roof of the mouth, and the lips closed. Those are the fundamentals of myofunctional therapy. So what myofunctional therapy is, it's like I'm a yoga instructor or a Pilates instructor, a personal trainer from the shoulders up. So I'm teaching kids how to breathe through their nose, how to chew, and how to use these facial muscles so that you can get the most developed face, the way our faces used to be. Because we're seeing a collapsing of the face because of how we breathe and the lack of chewing, and the lack of development. So when we chew, we actually develop the face that way naturally. And the tongue is what creates the arch form. So we want to make sure that we're stabilizing that position, and then we're allowing that face to grow naturally instead of waiting until 10 to 12 years of age and having to do expansion. Now, if I see that kids are not getting, the amount of space for the tongue that I want to see, then we work with an airway focused dentist that will do an assessment as well. And then we collaborate that way to make sure that child is developing the way that they should. And I recommend people look into Breathe, Sleep, Thrive, a book by Dr. Shireen Lim. She talks about, the importance of breastfeeding, and then growth and development patterns as children age, and then also assessments, what we're looking at structurally, and sleep assessments as well.
Yeah,
Airway.
amazing. Yeah, so the earlier we intervene, the more we can do.
We want to work with growth and development. We don't want to wait. And so anytime I have a family ask me, oh, I went to see an orthodontist, or I spoke to my dentist and they said, wait, that's when I recommend getting a second opinion, because that means that that professional is not aware of airway and airway focused dentistry. So we want to do we want to work collaboratively with the family and the child as they're growing naturally. Because a space issue and having to go through the traditional ortho route means that that was an airway and a function issue that we missed.
Yeah, amazing. Yes, this seems like something that most of us could benefit from doing. Is it useful for us as adults as well, even though we've already developed and we can't really grow our jaws anymore? Is it useful for us to see my myofunctional therapist still?
Yes, because if there's a sleep issue, like if people are snoring, they have a hard time, keeping their lips closed. If they notice that they get tired pretty easily when they're chewing, if they have any chronic pain, like chronic head, neck, facial pain, then myofunctional therapy could be a great option for those families. And plus, as we age, we want to always improve tone. Like we're talking about improving tone for the rest of our body, but we're not doing it for our face. So, what do we see in nursing homes with older, retired adults? They're choking, right? They're choking on food, they're choking on water, they're choking on their own saliva. So, we want to improve that oral tone even as we age so that we're less likely to choke and also improve our function and our breathing during the day and at night.
So even though we can't necessarily change structure, we can change function and therefore have a lot of improvements. Is that what you're saying?
Definitely. And I have a lot of adults now that realize they've got airway space issues, and now they're going through expansion as well because they see what's going to happen in 10, 15, 20 years, and they want to improve their airway and their tone as much as possible so that they don't end up having the same issues that their parents or grandparents experienced.
Right. So how can people work with you?
Yeah, so I work in person in Kingston, Ontario, 1 day a week, and then I also work virtually 2 days, 2 to 3 days a week from anywhere in the world right now. So how that works is usually someone will pop on to my website. It's called functionaloralhealth.ca, and we start with a 30-minute initial consultation. So what's involved with that is just questions people have because myofunctional therapy is not always the first place to start. There might be drainage issues, there might be heavy metal issues, there might be decay issues. So if anyone has any kinds of concerns regarding airway health, biological dentistry, or nutrition, then I can kind of go through the process of what might be the first step for them. And then if they decide that myofunctional therapy, going through the, exercise program and breathing optimization is a great step for them and for their families, then I can do all those sessions online, starting with an assessment virtually and then working through a program.
Amazing. So we'll keep your website and your social media links in the show notes, but can you just tell them to us just for people who are listening and not going to look at show notes?
Yeah, so on Instagram, my Instagram tag is functional oral health, and my website is www.functionaloralhealth.ca.
Great. Well, thank you so much for coming on here and spending this time with us and just providing so much information. It was incredible. I learned so much.
Great. Thank you so much for having me, and thanks for putting this together.